Hello, my name's Shannon and I am a registered adult nurse, currently working in my regional major trauma centre on the acute medical unit. The acute medical unit, lovingly known as the AMU, is a place that accepts admissions from GPs, from ambulance service and from the emergency department. As a nurse, I'm often the first person to meet the patient on the ward. I'll take a set of observations, I'll offer them a cup of tea, I'll take some bloods, I'll put a cannula in, I'll do an ECG. And the most important bit of that is their observations. We use something called a National Early Warning Score. Now, people's temperature, heart rate, blood pressure, respiratory rate, these all tell me just exactly how sick that person is and who I should be escalating their care to. Now, if they're scoring low, they can just wait for a doctor to come along and clerk them and tell me what needs to be done in terms of sorting out their treatment and finding them a diagnosis. Whereas if they're sick and the score is high, then I will obviously bleep a senior registrar and they will be assessed more quickly than other patients. So that's quite an important role that we play. As a whole, our team is responsible for the assessment of patients and diagnoses before they go off to specialty wards, and we're also responsible for stabilising some of the sickest patients in the hospital in an 8-bedded bay that we call the high dependency unit. As a nurse overall, once my patients are admitted, my daily role includes giving medications in a timely manner, making sure that people are eating and drinking, and making sure that they receive continence care is a big one, and that they don't develop pressure sores by implementing like hourly turns and checking that they're on the right mattress, making sure that their family are informed about where they are and what the treatment that they're having is doing and what the goal is. So that's a big part of what I do. There's so many great aspects to my job. In terms of parts that I love, I'd say it's always great to see the physical changes in a patient when they're actually getting better, and knowing that I've implemented the changes that are bringing about this recovery. That's always a great thing. I also enjoy the camaraderie. We're such a big team, and it's great to know that like my friends have my back in an emergency, and we have our resus teams and things, and although when it comes to it no one ever wants to be in that situation, I do know that I have such an incredible team behind me, and it makes it a lot less scary. Another thing I love about it is that every day is different. I see different patients for different reasons, and I give different treatments. It's a massive learning curve. I wouldn't change it for the world. I meet some great people and I learn some amazing things. So I hope this inspires you to join the healthcare sector. It's a great sector to be in. It's very rewarding. We're facing some challenging times at the moment, but the NHS is one big team, and I know that we'll make it through.